Welcome to the channel. Today we are going to give you tips on addressing the root causes of type 2 diabetes. Type 2 diabetes is a disease in which blood sugar levels are higher than normal. Prediabetes is a condition in which blood sugar levels are higher than normal, but not high enough for a diabetes diagnosis. The conventional treatment of type 2 diabetes is medications, which function to lower the blood sugar in the blood. But this does not treat the underlying causes. Without intervention, as much as 70% will develop the disease in their lifetime. The most significant contributors to all causes type 2 diabetes and prediabetes are poor diet and physical inactivity. Eating a healthy diet is important for everyone, regardless of diabetes status. But for people with this disease, nourishing foods eaten in the right portions provide two benefits. Reduced blood sugar. Lowering blood sugar that is high can help reduce diabetes symptoms and lower the risk for health complications. A healthier weight. Weight loss is associated with a better A1C result, a 2 to 3 month average of blood sugar levels. What is a good diet for type 2 diabetes? It includes whole, minimally processed foods, with fiber-rich fruits and vegetables, complex carbohydrates in moderation, lean protein, and healthy fats, and limits added sugars and refined grains. Diabetes-friendly foods to eat. While no two diabetes diets will look the same, certain foods are considered staples for people with this disease because they support a healthy weight and blood sugar level. They include 1. Fruit and vegetables. Rich in fiber, vitamins and minerals. Low in calories and fat. Aim to eat at least 5 portions of fruit and vegetables per day. Try to eat a rainbow. Combine several different vegetables or fruits of different colors to get the maximum vitamins and minerals. Limit your intake of fruit juice or smoothies to 150 milliliters per day, as these drinks have their fiber and carbohydrates already broken down. This means they can cause your blood sugar, glucose, to rise more quickly. They are also very easy to drink, so you can end up having too much, which means extra calories, carbohydrate and sugar. Potatoes are very high in carbohydrates, so don't count as a vegetable in terms of your 5 a day. Healthy fats, such as nuts, nut butter, and avocado, in moderation. Try to avoid the more sugary, high glycemic index, see below tropical fruits like bananas, oranges or pineapples, particularly in juiced form. Instead, eat lower glycemic index fruits like blueberries, strawberries or raspberries. Instead of eating a banana, snack on an apple, which has less impact on your blood glucose. 2. Meats, fish, eggs, beans, pulses, nuts and other proteins. Reduce intake of processed meat. Choose leaner cuts of meat and try to replace meat with beans, pulses and lentils on some days. This will reduce fat and boost fiber intake. Whether you're vegetarian or not, try substituting tofu for meat in stir fries and stews. Snack on a handful of nuts and seeds if feeling hungry, or sprinkle them on salads. 3. Fluid. Keeps you hydrated. Aim to drink at least 6 to 8 glasses of fluid per day. Avoid plenty of non-fizzy and no added sugar drinks. Water is best and is calorie-free. 4. Salt. Lowering your intake can reduce blood pressure and risk of stroke and heart disease. Reduce intake of processed foods and ready meals, which tend to have a high salt content. Prepare foods freshly where possible, as this gives you control of the amount of salt in the foods. 5. Foods high in fat and sugar. While we all need some fat in our diets, most of us get far more than we need. High sugar and high fat food and drink can contribute to weight gain, and sugary foods can cause sharp rises in your blood glucose levels. Reduce amount and swap type of fat to unsaturated alternatives such as vegetable, rapeseed or olive oil in cooking. 6. Why is food portion size important? Controlling your portion size can be a really helpful way to stabilize or lose weight. It can also help you to manage your blood sugar, glucose, levels better. Top tips for portion control include: use smaller size plates. Measure out portion size. 5 important take-home messages. 1. Carbohydrates, whether sugary or starchy, raise your blood sugar, glucose, more than any other foods. 2. Your diet should be high in fiber with plenty of fruit and vegetables, low in fat, particularly saturated fat, low in sugar and low in salt. 3. Be mindful of the portion size of foods you eat. Portions which are too large can contribute to weight gain and lead to poorer management of blood glucose levels. 4. If you're overweight, aim for 5 to 10% weight loss, using a method you are likely to stick to. 5. Diabetic foods offer no additional benefit above normal foods and so are not advised. Like, comment and subscribe. We out.